Hi, my name is Dr. Matthew Nuesse, and I have been a certified medical examiner for about 7 years now. And I'm making this video specifically for other certified medical examiners to kind of let you know how I perform a Department of Transportation physical on a driver and what I'm looking for, and the standards that are absolute set by the FMCSA and those that are kind of under your discretion, under the certified medical examiner's discretion, because I have gotten feedback on some of my other videos of what exactly should I be looking for when I am doing an evaluation of a driver. Now, I'm assuming other doctors out there, nurse practitioners, whoever you are that is licensed to do Department of Transportation physicals, that you know how to do a physical exam. But a physical exam from the Department of Transportation's standpoint is not the same as what a typical physical will look like. There are some differences. Okay, so one of the big differences between a DOT physical and a traditional physical exam is that during the DOT physical, we are not looking for health problems and how to treat or alleviate them. We are specifically trying to determine, is this driver safe to be on the road? And I do think there is some misconceptions about this from other certified medical examiners of what we're actually trying to do. So your job is not to try to find every health problem and then try to treat it or disqualify them because they've got a certain health problem. It is specifically to disqualify or not certify the driver if you feel that it's going to be unsafe for them to be on the road. That is a key point. All right, so now let me walk you through what I do during a DOT physical so you have a better kind of understanding of at least how I go about evaluating a driver, and I'm going to show you the actual intake form and kind of how I fill it out as we go. All right, so the first part is basically everything that the driver is going to fill out. They're going to fill out their personal information, which is basically who they are, their driver's license number, their address, and all that kind of stuff, and then their health history, which will give us an idea of how we evaluate this driver. Have you ever had surgery? And if yes, can you please explain below? Are you currently taking any medications? If yes, can you please describe below? So this is going to be our first indication of how we're going to go about evaluating the driver. Now, if they put absolutely nothing on this part of the form, they just say their health history is perfectly clean, it is going to shorten the DOT physical, at least the way that I do it. If they check yes or they say yes to a certain number of these questions, then we will want to evaluate these different parameters a little more closely. All right, so on to the next section. All right, this next section is a continuation of the driver's health history, and this is where you're going to get a lot more information. It's got different categories, and then check yes, check no, or they are unsure. And again, depending on what they check yes on here is going to lead us down specific pathways of how we're going to evaluate the patient as we go along. There is a portion at the bottom saying that if they have any other health conditions that were not listed, and if you answered yes to any of the questions 1 through 32, then it asks you also to explain your answers. And then we get to our section. So the first thing that we're going to do is we're going to ask different questions. Did they check yes on high blood pressure? Well, how long have they had it? Do they monitor it? What medications are they taking? Did they check yes on having any eye problems? Well, does that mean that they've had a previous eye surgery, or do they wear glasses when they drive, etc., etc.? So again, I'm not going to go through every one individually, but we should be asking questions that are pertinent to what they put on their health history. And then we actually get to the exam. All right, and this is the full exam form, basically everything on it that you're going to fill out. I start all of my exams with taking a driver's weight and height. So we will list that up there at the top. The very next thing I will do is take their blood pressure. Now the FMCSA sets up very specific blood pressure parameters. I'm going to expect that you know these, but the driver needs to fall into certain parameters to get their certification extended for either 1 year or 2 years, or they might not be able to be certified at all. The next thing that I will do is I will check their vision. And again, very specific parameters here. We're checking their vision. We're checking them to be able to identify different colors. We're checking their field of vision. I've done a video specifically on this in the past. And then I will check their hearing by doing the whisper test. And then typically what I'll do is a general neurologic evaluation, strength as well. So I'll check their reflexes. I will check their upper and lower extremity strength. But if they didn't check anything as far as having surgery on their upper or lower extremities or any neurologic problems, I won't do much more than that. Now, if they did, then maybe you will want to check sensation in different dermatomes, 2-point touch, et cetera, et cetera. You'll want to evaluate things that they checked yes on in their health history a little more closely. And then I will have them lay on their back and I will palpate their abdomen. I will then auscultate their lungs. So I'm listening with a stethoscope to their breathing. And again, if they check yes, do they have COPD or asthma or something like that, maybe you investigate this a little further. Maybe you do percussion on their lungs, etc., etc. And then I will auscultate also their heart. And again, if they checked yes, do they have a previous heart attack or a heart murmur, something like that? Again, something you might want to investigate a little more closely. But if they didn't, that's typically what I will do to check their heart, is just I will auscultate their heart. And then we move on to range of motion. You've got to have good range of motion. Does their spine move correctly? Does their neck move correctly? Can they bend over? Can they reach for their toes without pain? And then finally, we're going to get to the urinalysis section. Now again, the urinalysis is very cut and dry. The FMCSA sets up these standards. There's no interpretation here. And then basically that will conclude the physical exam. So again, there are certain parameters, vision parameters, hearing parameters, etc., that you have to know that a driver, if they don't fit into those parameters, they cannot be certified or they can't be certified for as long. But then there are some discretionary things as far as with their weight, with their heart, with their lungs. You've got to make a decision on if you think this person is safe on the road, and the FMCSA will give you some of those standards, and then you have to use your best judgment as a medical provider to be able to determine that with some of the parameters. So I hope that was helpful to everyone out there seeing the way that I do a DOT physical. And until next time, stay happy and stay healthy out there, and I'll catch everyone in the next video.